Today, we are reviewing the criteria used to classify community-acquired pneumonia as severe. Identifying these patients early is critical for appropriate triage and management. Understanding the classification. The classification of severe community-acquired pneumonia is determined by the presence of specific major and minor clinical criteria. First, major criteria. These criteria represent the most critical states of physiological compromise. The presence of either of these typically necessitates immediate, intensive care intervention. Respiratory failure, requiring invasive mechanical ventilation. Septic shock, requiring the use of vasopressors. Second, minor criteria. A patient may be considered to have severe community-acquired pneumonia if they present with several of these indicators. Respiratory parameters. Respiratory rate of more than 30 breaths per minute. Arterial oxygen pressure and fraction of inspired oxygen ratio is less than equal to 250. Presence of multilobar infiltrates on imaging. Neurological and metabolic status. Confusion or disorientation. Uremia, defined as a blood urea nitrogen level more than equal to 20 mg per dl. Hematological findings. Leukopenia, with a white blood cell count less than 4,000 cells per microliter. Thrombocytopenia, with a platelet count less than 100,000 cells per dl. Systemic or hemodynamic status. Hypothermia, with a core temperature below 36 degrees centigrade. Hypotension necessitating aggressive fluid resuscitation. If you found today's breakdown helpful, please subscribe to the channel to catch the next lesson.